thrilled to introduce Dr. Narjust Florez, who's going to give her study, Sexual Health Assessment in Women with Lung Cancer, the SHAWL study. Dr. Florez has really been a champion in this space, I think, and gone where others have been reluctant to go. She's the Associate Director of the CCEP and Thoracic Oncologist. She's a thoracic oncologist at Dana-Farber Cancer Institute and Harvard Medicine. She's also the co-founder of Latinas in Medicine and the founder of the Florez Lab, as well as the host of our ISLC podcast.
Thank you, everyone. It was quite different to be this side instead of that side in the last few days. We're going to summarize the results of the SHAWL study. The SHAWL study is the first sexual health assessment in women with lung cancer. These are my disclosures. Most of the data regarding sexual health in women and men with lung cancer precedes the approval of targeted therapy and immunotherapy. In addition, the majority of the studies that are dated as early as 1999 focus mainly in male patients, as the disease has been attributed more to be commonly in men, when in fact we don't know that's not the case. Sexual health is underreported and understudied. One of the honors is to work with a multidisciplinary team. The SHAWL study was designed before the pandemic, during the pandemic, and we pivot. The study was originally planned to launch in May of 2020, but we were able to modify the study and move forward. Some of the things that we're extremely proud is to have a multidisciplinary team, which included a certified sexuality counselor, OBGYN doctors, members of the GO2 Foundation and Longevity, as well as 2 excellent patient advocates that review every little piece of the protocol, including the logo before launch. This is an observational cross-sectional international study that was housed at the Lung Cancer Registry of the GO2 Foundation for Lung Cancer. We use a validated questionnaire, PROMISE, specifically the sexual health assessment of this validated questionnaire. The questionnaire has been validated in all patients with cancer, but a minimal number of patients with lung cancer. So what are the results of the SHAWL study? Despite the challenges of discussing and having a study that is taboo in oncology about sexual health and a war pandemic, we were able to recruit 249 women. They range for age 29 to 34, and their average age was around 59 to 60 years. 88% were white, non-Hispanic white. The majority had adenocarcinoma at 81%, and 41% of the patients were currently taking targeted therapy at the moment of the assessment. The results are sobering. This is a question that should have been asked many years ago. 77% of the patients in the SHAWL study reported moderate to severe sexual dysfunction. So what this means? It means that these women's sexual dysfunction is affecting their daily life. They often think about the lack of sexual activity on the daily basis. And I want to stop here to remember that sexual health and sexuality and intimacy is not only about penetrative intercourse. This includes self-stimulation and masturbation. This includes kissing, cuddling, other forms of intimacy, which includes massage, for example. It is time to think that sexual health is only about penetrative sex. Our patients can have intimate sexuality in many ways. And still 77% of them have moderate to severe sexual dysfunction. Out of the 127 participants that had sexual activity in the last 30 days, 59% of those reported significant issues with vaginal dryness and 26% with vaginal pain, discomfort during sexual activity. We have many comments about postcoital bleeding that was often not discussed with their oncologist or primary team. We asked questions before and after lung cancer diagnosis, and significant differences were noted. There was a decreased interest or desire for sexual activity before and after lung cancer diagnosis. Vaginal pain and discomfort was significantly different between before and after. We control for confounding aspects like medications that affect sexual health and the history of mental health disorders before the diagnosis of lung cancer. So what is important about the SHAWL study, it reminds us we cannot extrapolate data from other cancers to lung cancer when it comes to sexual health. We often extrapolate data from breast cancer. It's a very different cancer, it's a very different mechanism, and the therapies are night and day when it comes to sexual health. We do not use hormone deprivation therapy in lung cancer. So the number one cause that patients reported that was affecting their sex life very much to somewhat was fatigue, something that we often kind of brush off. Feeling sad or unhappy. Issues with their partner, which are also associated with sexual health. It's a vicious cycle. If it's lack of communication, lack of intimacy, is associated with partner issues. And very importantly and highlighted is shortness of breath. When you look at other studies about sexual health, shortness of breath is really in the bottom if we mention. But in lung cancer really matters. And there are interventions that can help our patients have intimacy while dealing with limited lung capacity. What is your take-home message from the SHAWL study? Sexual dysfunction is prevalent in women with lung cancer at 77%. Additionally, sexual health should be integrated into thoracic oncology care now, not tomorrow, now. Further research is necessary to develop tailored interventions for patients with lung cancer. We cannot continue to extrapolate data about sexual dysfunction to treat women with lung cancer with sexual dysfunction. The Florez lab is working in developing a multidisciplinary intervention that will go for addressing shortness of breath with teaching our patients the adequate sex positions with limited lung capacity to understand the difference between vaginal lubricants and vaginal moisturizers. This is the take-home message for you. It's time to talk about sexual health and lung cancer. We want to acknowledge our study participants that in the middle of our world pandemic took time to answer this lengthy survey that often brought different types of feelings about their sexual health. It is a hard survey to answer. You have to do a lot of introspection, especially for patients that are not sexually active. I would like to thank co-investigators, Ivy Elkins, Jeep Feldman, and Amy Moore. They believed in this idea in 2019 when we met in Barcelona for the first time. And they were so comfortable talking about vaginal dryness since day one. The University of Wisconsin, who gave me my first job, the GoTo Foundation, the Dana Cancer Institute, and to all of you for listening and taking action starting today. Thank you.